Yep, and now over to our next speaker. I would like to introduce also another very special speaker that we have invited over from the US to join us today, also in a very unacceptable time zone. Thanks very much, Terry, for joining us today. And I had the good fortune of meeting Terry in one of the IAA meetings earlier this year in Seoul. And yeah, Terry's here today to share with us about the climate change effects on life and health insurance claims and how we can use this for our stress testing as well. So, sorry, just let me pull this up a little bit. Okay, so Terry is a fellow of the Canadian Institute of Actuaries, and he has over 25 years of industry experience in a variety of roles. And he has worked in both the US and Canada. And more recently, he has focused much of his efforts in health insurance. And he's the chair of the Health Forum on the IAA, the International Actuarial Association. And he's also a longtime volunteer of the CIA, SOA, and other organizations. And he's traveled to Asia and Africa to work with local insurers in developing microinsurance on behalf of a Canadian government-sponsored organization. So over to you, Terry.
Thank you so much, Joanne, and it's so good to see you again after meeting in South Korea back in May. One correction: I'm in Canada, not the United States,
Oh, yes.
but it's still pretty late here. So, welcome to everybody, or I would just want to say hello to everybody in Singapore. I know it's morning there, so maybe I'll say good morning. And I thank you for the invite, Joanne, to speak about the presentation. I don't know, should I be pulling it up or are you pulling it up? I guess I can pull it up and share it. Are you
Yeah, I think
hearing
you can share it from your side if that's
from
possible.
my side? Okay,
Yeah.
let me just see if I can find it here. Um, all right, hopefully it's coming up. Give me a second. All right, it should be on the screen, I think. Let me put it into slideshow mode. Okay, hopefully it's come up. So I want to chat about a little bit before we jump into the presentation. I wanted to chat about how this presentation came about. So back in April of this year, I was asked to do a presentation as the chairperson of the Health Forum of the International Actuarial Association to a working group of the International Association of Insurance Supervisors. So I put this presentation together and sent it or gave it to them, presented it, and got some really positive impact from some of that working group of insurance supervisors. As a result of that, I presented it at the Korean meeting of the Health Forum of the International Actuarial Association, and word started to spread. I think Joanne heard about it and others. Back in June, I presented it to the Conference of Consulting Actuaries in North America. In July, I've presented it to the Geneva Association in Switzerland. And now I'm presenting it in August, the end of August, to the Singapore Actuarial Conference. So I've been presenting it literally every month since it's been developed. So let's jump into it because I think it's an important topic. So the very first slide is really a reflection of what insurance companies today think about climate change and its impacts on their business. So this was research done by RGA Re in South Africa to life and health insurance companies, but I think it's reflective of attitudes of insurers around the world. And there's an intent to expand the survey to the United Kingdom and some other European countries. But to start, I mean, insurers have a mixed view on the level of priority to place on climate change. 55% rated as low or no priority, 45% is moderate or high priority. However, 55% of insurers believe that climate change will have a material impact on their business in the next 5 to 10 years. 58% of insurers have implemented or plan to implement some sort of sustainability program to manage risks and opportunities from climate change. Oftentimes you get investors asking about um, sustainability programs. Sometimes you have clients asking about it. So insurers are certainly taking that step to create sustainability programs. Insurers, when they're asked about climate risk, they tend to turn to their risk managers 85% of the time. So that would be actuaries and other risk managers. And then the risk and regulatory and reporting functions, 50% as well, to understand and manage associated risks. So regulatory reporting would probably be your accounting and audit folks. As I was putting the presentation together and building out my model, I used something called the NGFS scenarios. So NGFS stands for the Network for Greening the Financial System. And why did I use these scenarios? They're not as well known as, say, maybe the RPC scenarios, but they're being used by central banks and supervisors. Excuse me. And the reason they're using them is the central banks and supervisors are looking to explore impacts to the economy and threats to financial systems from these scenarios. And the scenarios themselves provide a window into different possible futures. So there's 7 scenarios, and they're broken down into 4 groups or subgroups. So there's the orderly, and the key one being net zero 2050, which I think lots of people have heard about. There's the below 2 degrees Celsius. So we keep the temperature of the planet from rising by no more than 2 degrees by the end of the century. There is the low demand world, which is the best, meaning we all get off of carbon. Disorderly, where there's a delayed transition in terms of carbon use. The hothouse world, where nations kind of determine their own contributions to climate change or if continue to follow their current policies. And the too little, too late or fragmented world, which is the worst of all scenarios. So what's my hope from producing this model and using these scenarios? Well, I really would like to see actuaries incorporate some of the effects of climate change in health and life insurance in their pricing, in their valuation, and ORSA stress testing or any other sort of stress testing that they get into. What I'm going to attempt to do right now is to jump into the NGFS scenario portals. Hopefully this works. Let me know if you can see the NGFS scenarios, Joanne. Is it up?
Not yet. It's still on the same slide that you were showing earlier.
Oh, it's still showing the same slide.
Yeah.
Okay. What I will do is I will stop my share and I will go back and share. Let me go see if it pulls it up. Here it is. Sure. Okay, let me know if that comes up in a minute or two. The top says
Yep,
the
we can see
future.
that.
Yep,
Yep.
you can see it now. Okay, so this is the
Yes.
NGFS portal. I'm not going to go through everything that's in here, but I would encourage folks or people that have an interest in this subject to maybe spend some time in this website. I think it's got a lot of great information on climate change. But the future is uncertain, as it says. The NGFS scenarios provide a window into different plausible futures. You can see the 7 scenarios kind of scrolling across my screen. Climate change is one of the defining challenges of this decade. Here are the 7 scenarios that I mentioned with definitions to the left. And then I'm going to, hopefully I don't make you dizzy by cursoring down, but I will go down to the scenario section a little bit. It's got some interactive data. You can see some more of the 7 scenarios being projected. Let me just try and cursor down a little bit. More definitions. But some of this is actually, as you can see, okay, so here I've got net zero 2050. And if you look at the graphs in blue and orange, if I click a different scenario, let's go fragmented world, you can see how some of this changes. So there's opportunities in here to kind of interact with some of these scenarios. I'm going to stop sharing right now. Now what I'm going to do is I'm going to jump back and share the rest of the presentation. Let me go share. And hopefully that came back up. So let's jump to the next slide. Um, so how did I build my model? What are the assumptions? What are the goals from it? So again, I built this model to determine extra life and health insurance claims from climate change by country. The products include life, disability, critical illness, cancer, hospitalizations, and long-term care. And the extra claims, again, my goal was to get this model in pricing and valuation and ORSA stress testing. My conversations with the working group of the International Association of Insurance Supervisors, I mean, they certainly showed a lot of interest in it in terms of what I was saying. So who knows where all that's going to go. I kind of think it's a blind spot and a risk right now that exists in the insurance industry. Um, the backbone of the model are really two key assumptions. The first one is the relationship between CO2 emissions and healthcare costs. And the second one is lung cancer from pollution. So there was a UK study that showed that in the future, an extra 10% of lung cancers will be caused by climate change. And there was a Chinese study that showed almost a one-for-one relationship between the future growth in CO2 emissions and healthcare costs. There's additional research that shows up to 50% of all cancers in the future may be impacted by climate change. Excuse me. The American Lung Association shows that 25% of all cancers are lung cancer related. And for a product like critical illness, 70% of claims are cancer related. There's research that shows that if someone, for instance, loses a home following a climate event like a flood, they suffer from mental health and disability claims. I mean, it's easy to sort of understand, someone loses their shelter, what would happen to them mentally as well. We know 10% of all people that go to hospitals are going there for cancer, at least in the research that I've shown. It may be, vary by country, but and so I think this is all going to erode profit margins of insurance products and threaten insurer solvency. And so I asked the question, are insurance companies appropriately reserved and capitalized for these risks? This is some output from the model. And what I've done is I've got the 7 scenarios across the top, and I've got projections from 2030 to 2050. And you can see if you look at the scenarios to the right, maybe the last 3 scenarios, if you look at 2040, you can see 7%, 8%, 9% increases in claims. When you think that the average life insurance or average insurance product has a 5% profit margin before tax, I mean, 7, 8%, 9% increase in claims can significantly wipe out profit unless you're capable of raising rates. So this slide I didn't put together, but I did borrow it for the presentation. So a couple years ago in Brussels, Belgium, we had a presentation from a former president of the International Actuarial Association, and he came and spoke to the health forum about climate change and health effects. So he's really big into climate change. And this is kind of showing which countries or regions of the world contribute the most to climate change. So I don't know much about this. I mean, this is just some statistics he put together or found somewhere. Secondly, I mean, he's a great champion of actuaries really getting involved in this cause. And so, he says the actuarial profession, and I believe this as well, is uniquely qualified to help optimize a global response to climate change. So I think what I'll do before I jump into the model itself, maybe I'll pause and see if there's any questions. I don't see. Screen sharing has stopped. So I don't see anything in the chat or Q&A, but
Yeah, well, maybe I'll start with one. So, of all the various scenarios that you've considered, I think it was 7 of them. Have you also have a view yourself about which ones of these you think would be more plausible of where we'll end up?
I do actually. I think it's going to be a disjointed world with nations doing their own things. I I mean, I've built my model sort of to be, I think, conservative in what it's predicting. And
Okay.
I did that deliberately. I mean, I think we as actuaries sometimes we want best estimate plus the pad. But I think for all nations to get together, we can't even agree as a planet and on what time it is. We're really going to agree on climate change. When I did, when I did this presentation to the conference of consulting actuaries, there was one particular person who gave me a lot of pushback on climate change. And I'm not here to be a proponent for climate change being real or not. I mean, that's not this discussion. This is a model to help the insurance industry, life and health. So much more is being done on the P&C side, as I think Frank can agree, related to climate change and its effects, floods and wildfires and things like that. But I think the life and health insurance industry, there's not a lot of data out there right now. Somebody's giving me a thumbs up. Appreciate that. But yeah, not as much being done in the life and health space. And I think as this is certainly a start to addressing some of the challenges that the life and health insurance industry will face going forward.
Do you think you
So
could
if it's
share a bit more with us about the kind of data sources that went into this? Because in this part of the world, here in Singapore and around us in Asia, I think critical illness risks, health insurance risks, long-term care, like these are all very prevalent risks that we write a lot in the protection business, especially. So maybe give us a bit of a talk through, like what was the approach to the models?
Yeah, maybe I'll save that for when I go into the
Okay.
model itself, just to kind of show it. But I appreciate that. There's one that just came in.
Okay.
How do you model regional heat wave wildfires, specifically when evaluating impacts on lung cancer? Um, yeah, it's a really good question, and I was asked that when I did the presentation to the working group of the International Association of Insurance Supervisors, and the specific example, Sam Gutterman was the other presenter with me, who was the former Society of Actuaries president. And in California, there's all these wildfires, some of them coming from Canada, and some of the statistics out there are worse in other parts of the United States, for instance. And I'm sure that exists in many other regions. But I haven't specifically added anything in the model at this stage, apart from an overall additional increment to deal with things like heat waves and wildfires. So regions, I've got countries broken down. So maybe it makes more sense. Maybe if I jump into the model, I appreciate the question. But maybe if I jump into the model, maybe it'll explain a little further how I've handled these situations. So let me share that right now. Um, Models here. Let's go ahead and bring it up. So what I'm going to do is so it is an Excel-based model. I will go through many of the sheets in here briefly, but first of all, the first section's got notes just on the model itself and some of the assumptions. There is a disclaimer section. Well, it's the property of my company and not to be used without or modified without our permission. I'll go into the assumptions sheet, which I think will address some of the questions. So I think this is one of the key sheets in here. So I've got the 7 scenarios listed. And then anything in yellow is something that's user input. So users can certainly modify that input. So if some of these statistics in Asia and other places were different than maybe in North America, those can certainly be modified. So the first thing I have is what I'll call an annual claim inflation. And I'm using a number of 1%, but it doesn't have to be 1%. It could be 0. It could be 2%. I mean, I just that's a number that I thought was something to use as annual inflation. On at least on the health claims. I mentioned the UK study that says 10% of future lung cancers will come from climate change. Data that I have says that 70% of critical illness claims are for cancer. 8% of long-term disability claims are for cancer as well. Lung cancer, and this model primarily focuses on lung cancer, by the way. For people spend or the duration of lung cancer is 48 months. People spend about 6.3 days in the hospital when they have lung cancer. As I mentioned before, 1 in 10 individuals entering a hospital does so for cancer. The American Lung Association says 25% of all cancer incidences are lung cancer related. There's a global organization called GloboCan, which collects worldwide cancer data. And for cancer mortality or deaths, 18.7% of all cancers are lung cancer related. I'm just cursor down a bit. Mental nervous as a percent of disability claims is 30%. I use an insured to population adjustment of 70%. And the understanding is, and obviously somebody who's buying insurance is probably more affluent than the general population. So these adjustments have been used by actuaries to make adjustments. Obviously, someone who's a little bit more affluent may be able to afford air conditioning or weather the effects of climate change better. But on the other hand, we're all breathing the same air. There was an Indian doctor who said that everybody on this planet is a smoker. They're finding these black particles in people's lungs. So because of all the forest fires that have happened and other pollution, we're getting things in our bodies now that are reflective of, to some extent, climate change. So I make a life to health adjustment in the model just because life is different. And again, using the sources from GloboCan to adjust, someone, just because someone gets sick doesn't mean they necessarily die. But in many cases, someone who gets lung cancer or other things may move on to death at some point. I have a country factor based on regions that drives future CO2 emissions and annual growth rates in cancers. Then I have a product mapping, which kind of covers some of the assumptions up above. To the right, I've got this chart. Now, this happens to be Sweden that I picked, but it looks at lung cancer, deaths, mortality per 100,000 of population for males and females between 1955 and 2015. So I've got this chart up here, which is looking at what I call physical risks. I know somebody asked a question about, I think, for wildfires. So we've got coal-related deaths, heat-related, coal power stations, air pollution, wildfires, others, droughts, floods, food insecurity, vector-borne diseases, tropical cyclones, storm surges, sea level rises, and overall impact of climate change and death. And then the anticipation in the future is an additional 40 basis points of change in that source. Just to the right of that, I've got predictions from the NGFS portal of what happens under these 7 scenarios of CO2 emissions going forward. This next sheet, again, the 7 scenarios from the NGFS portal and projections of CO2 emissions to 2050. I've got things like here, I've got some mapping. You've got country codes, region, and country. Let's go find Singapore. I'm sure it's in here. So I'll close that. Let me see where we at. So Singapore, the country code is SGP, Asia, Singapore. Let me see if I can cursor back up to the top. And so I've got the various products listed here that you can run the model through. I've got lung cancer annual growth rates by region. And then I've got additional information that I pulled in. This one probably isn't too useful from some of the NGFS scenarios and other things, land use mapping, energy country. This one's, I'm going to show this, not the whole sheet, but I'll do this for the world, and it's CO2 emissions. And so it makes a prediction of CO2 emissions out to, I think, 2060 or the end of the century. So the key thing everybody wants to see is, what does the model look like? So here's the output. So here you can go in and you can choose your product, okay, that you want to model. Then you can decide if you want to include the physical risks. It's a strict drop-down menu, yes or no. So that physical risk is this 40 basis points that I mentioned in the assumption page. There is whether you want to include lung cancer or not. I mean, it's a straight yes or no. You can choose any of the 196 countries on the planet. I happen to have United States here only because I was doing this for the conference of consulting actuaries in North America. It projects out things like, so the CO2 emissions, and I do a change in those emissions over time, depending on scenarios. I mentioned the Chinese study, which showed almost a 1-for-1 relationship between CO2 emission, the growth in CO2 emissions and healthcare costs. Yeah. But I dialed that down by 50% because I thought it was too severe. And so here I've got my 7 scenarios from the NGFS portal, and the model just simply makes predictions of what's going to happen. So, I mean, even if you go to like 2035, some of these scenarios, you see 11.3%, 9.1%, 10.2%. I mean, those are significant, I think, to the insurance industry. I look at the one scenario is negative, and that's the low demand one, which is the world all getting off of carbon. But I mean, my thing is, I think really something like delayed transition, that's 6.8%, maybe much more in line with what happens with the world in the current state. 2035 is only 11 years away, so it's not that far away. So I think it's something that insurance companies and actuaries need to be thinking about. Is it a blind spot in our risk profiles? And this is an interactive, the bottom shows an interactive graph that just responds or changes as this data changes. So that's it as far as my presentation goes. I guess the one other thing I'll say is, nobody goes to a hospital or wherever and dies, and the doctor says you died of climate change. Nobody gets sick and the doctor says you died of you got sick because of climate change. So it's always, oh, you got sick because of lung cancer, you died because of lung cancer. But getting climate change statistics is much more challenging in terms of deaths and health effects. But the researchers out there have been able to do some work on it. So I'll pause there. I'll see what comes in terms of questions. And okay, I can see the chats coming in. It's looking at lung cancer specifically. So someone's asking, does this look at all CI claims or specifically CI from lung cancer? Yeah, and right now I'm only considering lung cancer because that's what I had, the most data on. But as I mentioned, there is research out there that suggests that 50% of all future cancers may be climate change related. But it's hard to use that to model anything. If it's just sort of anecdotal, I need actual hard data to put in the model. And that's why I say, to some extent, this is conservative. I'm not considering a whole host of things in doing this. So things like mental illness are not part of it. Let me see. I see there's 4. All right, I've got some other ones. I'm just going to try to go through them and answer live. What are the factors considered in setting all the level of input parameters? Well, I mean, the factors are really the assumptions, right? I mean, I talk about the Chinese study, I talk about the UK study, and some of the, let me see if I can hop back to the assumption page. I mean, these are all the factors that are driving the model at this point. So hopefully that answers your question. I'm just moving on to the next one. Have you considered humans' ability to adapt as well as improvement in health conditions amongst those who are living in very cold places? Have you considered, sorry, it's moving, the screen's moving around on me. Have you considered humans' ability to adapt as well as improvement to health conditions amongst those who are currently living in very cold places where climate change unintuitively improves health outcomes? It's interesting because on the assumption page, I'm going to have to move the Q&A over, I think, because it's kind of blocking my thing. But um, on the assumption page, I did have coal. Let me see if I can cursor down a little bit. I don't know if you can see the coal related section, and there's actually more deaths in coal related than heat related, which is interesting. I know there was like a major heat wave in Europe and Africa. Um, I don't know, about a month ago or so, and I heard something like 1,000 people had died in Africa. So I mean, just really large numbers. But I'm just taking the overall information. I'm not breaking it down to that level of granularity between heat and cold. Yeah, I mean it looks high, but the other question, this looks very high. If this is true, how can insurers guarantee rates for the long term? Well, again, I think it's a blind spot, right? I think it's something we need to consider. It may be showing up in other ways. Like I said, nobody ever dies of climate change, according to the doctor's death certificates, or gets ill. So it may be showing up in other ways in claims. And if this continues, again, I think it's something we need to be aware of. I still think I built a model to be conservative. Um, but we'll see in time if that pans out or not. Yeah, and again, I mentioned the issue about not being able to raise rates. Most of the scenarios imply that loadings are necessary. This could lead to the product being less marketable, especially if your competitors aren't doing the same. How do you suggest navigating this? I think if the insurance supervisors come in and say everybody's got to stress test their products to see where they stand, then it could result in insurance companies having to raise capital or at least add to their capital if they're not well enough capitalized. If you include it in pricing, yes, I agree. Maybe your product becomes less marketable. But on the other hand, if you know you're covering the risk appropriately, then you're protecting your company. You're less likely to have solvency issues or have your company be bought out. So that would be my suggestion around navigating it. I know it's not easy to raise rates, but if there's justification, then this sort of stands behind it. So I think there's another one. Does the climate change expected to affect the mortality as well? Example, flood, typhoon, and heat wave causing more deaths. Yeah, so the model is designed to cover both life and health. I'm just gonna hop back. Let me see if I can go back to the scenario. So there in the drop down, there is life insurance as well. And that's why in the assumption section, I make a life insurance adjustment. So, but we as actuaries, we have to start somewhere, right? We have to have something to kind of quantify, because if someone asks us about this and we don't have an answer, uh, then it becomes we're sort of starting from scratch, and it can be difficult to tell people we don't have a model to do this. So that was my whole intent in building it. Joanne's typing an answer.
I know, I was just addressing one of the earlier questions and thought I'd put my 2 cents
Oh,
in, but please go ahead.
no, no, go ahead. Which one? Which one? No, I'm done. Which one do you want to add
Oh
comments
no, no,
on?
I think it was just an earlier question on the marketability and then competitors not doing the same. Actually, just for your context, we do have, health insurance in Singapore here where we've been dealing with premium increases and in the last couple of years. And um, I suppose in this case it's kind of similar where it's a first mover disadvantage. So I was just going to make a comment about, how the importance of public education and just coming together as a whole industry and association to recognize the importance of climate change and the impact to life and health, and then move together as a market. But I was just going to reply privately.
I
Okay,
see. I see. I didn't
no
mean,
worries.
I didn't mean to embarrass you, but
No, please go ahead.
sorry, Joanne. Yeah, no, interesting questions. And we as actuaries, we educate each other, even if we work for different companies, and we learn from each other. I will tell you that I've submitted this model. I wasn't going to mention this, but to the insurance ERM organization, which is worldwide, for a potential award on climate change. And I think as more and more people find out, it almost becomes, well, maybe we have to do something about this. So because word is starting to get out to more and more actuaries that are talking about this subject. I think the Society of Actuaries has a climate change, I'm not going to call it exam process, but they have some sort of, I don't think it's a designation, but I know they're doing some work where people can take courses in climate change. So it's becoming, I don't know if Frank's still on. I don't know if the CAS is doing anything with climate change, but um,
We have a
so
committee
be
that we
interesting.
just formed on it, but I agree that we're a bit behind. Like we all should be doing more.
But see, my belief has always been the PNC side of the shop has always been ahead because they're more impacted by climate change right now by things like floods and obviously earthquakes, typhoons, you name it, wildfires. So,
Absolutely.
all right. Anything else? I don't know if I'm missing anything.
Yeah, I think we've covered the questions in the
Okay,
chat.
there's one here. Are these excess claims applied to the specific condition, in this case, lung cancer, or is it at the overall portfolio level? So there are really two things that are driving this. One is just lung cancer, and the other one is the growth in CO2 emissions under these seven scenarios. So there's really two factors that are determining the potential increase in claims, as well as obviously product differences and country differences, region differences. So I don't see
Yeah,
anything else that's come in, but
if there are no other questions, I think it's okay for us to end the session earlier than earlier as well, Terry, unless you had any other final comments to make.
no, I really enjoyed it, and thank you for the invitation.
Yeah, I think it's really meaningful. I mean, like what I said earlier, and you've mentioned this several times today as well. The PNC side of things, or well, it's not only PNC, but I think there's a lot more topics or kind of easily relatable real life examples of how climate change affects the risk that we insure on the PNC side. But to most of us here, especially since climate change is still quite a new topic in this part of the world, and we're as actuaries, we're also starting to get acquainted with our understanding of climate change effects slowly. So having your presentation to kind of walk us through the effects of climate change on specific life and health risks, I think that was really eye-opening to us.
Thank you. I see a comment coming in here from
From James, yes.
James. Excellent model, which demands much analysis. Thank you so much. I know we got 3 minutes left, but I just wanted to ask Frank. Frank, did you and I sit on an exam committee together?
quite possible. I was on a joint exam committee a long time
Was it
ago.
FM?
For,
Course FM?
yes, it was FM. Yep.
Do you remember me at all?
Yes.
Yeah, I do.
And Bob
I do
Alps.
remember you. And Bob Alps. Yes, yes. I had dinner with Bob a few years ago in Chicago. But all right, we're great that we have connected again through this.
Lovely to
Harry, you're
see you
not
again.
exactly forgettable, but okay.
Oh, thanks. I'm not forgettable. No, okay, great.
Thanks very much, Frank and Terry, for your time this morning. I think it's very eye-opening for our audience here in Singapore. I know it's definitely very late over in Brazil and Canada. So once again, on behalf of the Singapore Actuarial Society, thank you very much for attending our conference today.
Great. Thanks for having us. Bye.
Okay.